Good afternoon. This is Mark Province from the Healthcare Authority, welcoming you to today's webinar. Before we get started, just a couple of reminders. Use your phone to dial the number in the audio section of the webinar panel. If you have questions, please use the question section to submit any questions. We'll gather those and we'll answer those at the end of the presentation. So with that, today's webinar is, as soon as I can advance the slide, today's webinar addresses the ACH project plan assessment, which is part of our Medicaid transformation project demonstration. Again, I'm Mark Province. I am Director of the Office of Medicaid Transformation here at the Healthcare Authority, and joining me as speakers today are Terry Branning, Senior Manager, and Jennifer Caristis, also Senior Manager, both with Myers and Stauffer, our contracted independent assessor. They'll be handling the bulk of the presentation, but before I hand it over to them, just a few things to kind of put our discussion today in context. So the agenda for today, we'll talk a little bit about the demonstration. I'll give you a bit of an update. And then Myers and Stauffer will discuss the role of the independent assessor, key themes from the public comment process, criteria, categories, and the scoring methodology that they will apply, and the project plan assessment timeline and the approach. Sorry, I'm having trouble driving this slide presentation. Okay, thanks. So the purpose of today's presentation is to explain the project plan review process and timeline, and to discuss the feedback that we received. As many of you may know, we did put the project plan out for public comment, and we thank all those of you who did take the time to submit comments to us. The goals really today are to gain an understanding of the independent assessor's role, and to gain an understanding as well of the project plan review and assessment process. I won't go through all of these terms, but just to let you know that these are available to you, and actually I believe these slides will be made available after the webinar, so you can always go back and refer. I think most of these terms will probably be known to many of you. One that I do want to call attention to is the very last one, which is the project plan assessment review tool, and that really will be the focus of the bulk of our conversation today. So I'm sure many of you know this already. The Medicaid Transformation Project is a 5-year demonstration authorizing up to $1.5 billion in federal investments, and really focuses on 3 initiatives. We'll spend our time today talking about Initiative 1, which is transformation through accountable communities of health. As a reminder, however, we do have 2 other initiatives, one for long-term services and supports, and one for foundational community supports. Speaking of Initiative 1, this really focuses on transformation accomplished through our 9 accountable communities of health. Again, I think many of you are probably familiar with those ACHs and where they're located geographically. The ACHs, of course, are critical in providing us with the information and with the proposals regarding the project plans to be undertaken within each region. And it's the review of those proposals, again, that forms the project plan review process that we'll be discussing today. Just a little bit in terms of where we are to date. As I think probably most of you know, the ACHs have all completed a 2-phase certification process, which was a successful activity for all 9 ACHs, and earned each ACH design funds that really serve as the initial investment to bring these project plans forward. We have contracted with Myers and Stauffer as our independent assessor. When the ACHs submit their project plans, which will be due November 16th, Myers and Stauffer will undertake the task of reviewing those project plans and scoring them according to the outline and the process that we described previously, and using the project plan template that was recently reviewed and that we'll be discussing today. So those project plans really do represent the portfolio of projects that each ACH will be bringing forward and using really to accomplish the transformation goals that we've set out as part of the demonstration. With respect to the project plan template, again, we appreciate the feedback that we received during the public comment process, and we have made some changes based on the comments received. A number of those are really summarized here. We did make some adjustments to the supplemental workbook, which is a required document that each ACH needs to complete. And the workbook really now requires the ACHs to really describe to us a high-level distribution, percentage distribution of incentive funds by use category. We also took the opportunity to clarify some of the definitions that are used in the workbook itself. We also clarified our approach to having the ACHs describe the use of managed care incentives rather than having them describe to us a precise allocation. We're now wanting them to describe how those incentive funds will be used more in narrative form. So that was another change that we were able to make based on the comments that we received. And then finally, we made some minor revisions to some of the questions related to Domain 1 activities. And as many of you may know, Domain 1 really serves in a way as a foundation for the projects that are undertaken in this demonstration. What we were able to do in terms of changes to the Domain 1 section was to clarify that, again, the Domain 1 activities, which involve value-based payment, workforce development, and population health management, that those really are intended to support each of the projects. So we're looking for a direct relationship between those Domain 1 activities and the projects that are brought forward, and really looking for some preliminary thinking by the ACHs along those lines. This really just reviews the process that we followed. We did invite public comments. The public comment period closed October 13th. We did receive comments from a number of stakeholders and partners, as shown here. And really, the purpose of today's webinar is to cover how that input informed the refinements that we made and will really help guide the process going forward. So with those introductory comments, I would like to transition the webinar to the Myers and Stauffer team.
Great. Thank you, Mark. My name is Terry Braining. I'm with Myers and Stauffer. And I'd like to start off with just giving a little background about Myers and Stauffer and our experience. Myers and Stauffer is a CPA and consulting firm. We're celebrating this year 40 years of consulting and providing Medicaid policy expertise to our clients. All of our clients are government entities exclusively, and we are virtually in every state at this point in time. Many of our professionals that work on our team come from Medicaid programs, health plans, fiscal agents. There may have been providers in the community. So we have a broad spectrum of expertise that we can bring to our clients and to projects. We also have about 800 internal associates that support us in any project and will, and with respect to this initiative as well. The team that we are going to be talking about today includes individuals with extensive experience in healthcare delivery and payment transformation across a couple of states. Our team members include nurses, an attorney, and individuals, the majority have spent most of their careers in the healthcare industry. We also have some subject matter experts within the firm that are also available to support the assessment, and we'll talk about those in just a minute. So in terms of our DSRIP experience, we have more than 15 years of experience with Section 1115 waivers. Our experienced staff is actively involved in DSRIP programs in Texas, New Hampshire, and New Jersey since 2012. We have supported reviews of nearly 1,600 DSRIP project plans, which is pretty significant. And we also have experience developing DSRIP project application processes, the assessment tools and criteria that are used, and then obviously conducting the project plan reviews and providing stakeholder feedback. So what you see here now is a graphic depiction of our organization, the team that we bring to this project. You'll see that at the bottom part of the organizational chart, there are 3 distinct teams. These teams have been established as part of the work order for this project and will support the engagement throughout. There are other members of the team, a support team, that support these individuals. And even though you see these individuals siloed across these teams, the independent assessment team, the incentive payment and data analytics team, and the communication and resource team, we're all talking to each other. We all work very closely together. Since we've been awarded this project, we've been meeting regularly to discuss across all of these silos. So just wanted you to get a feel of what the team looks like. You'll notice that, as we'll talk about in a few minutes, that these team members will also be the primary and secondary reviewers as we move forward with the assessment. So one of the questions that has come up during the public comments is, what does an independent assessor do? So while this is a graphic depiction of that, there's a couple of key things to walk away with today. At a high level, our responsibility is to support HCA and the ACHs in ongoing monitoring and reporting and helping to achieve success. So there are several things that are around that, but all of our work begins with the project plan assessment. That's really the foundation of the work moving forward. This is really the baseline. We'll then conduct semi-annual assessments through which we will work to identify at-risk projects. We'll do that with both HCA and the ACHs. In demonstration year 3, we will conduct a midpoint assessment of each ACH's progress, and we will support with other initiatives throughout, including CMS quarterly reporting will support HCA with that. One of the things that has come up in the discussion is, how does an independent assessor differ from an independent evaluator? Many of you may know that when CMS funds large projects like DSRIP or STEM or Certified Community Behavioral Health Clinic, they will require an evaluator as part of the process. For DSRIP, they require both an independent assessor and an independent evaluator. So an evaluator will contract with the state, as they are with an independent assessor, with Myers and Stauffer, but that independent evaluator will really focus on the full Section 1115 MTP initiative. They will also develop a program evaluation plan that has to be approved by CMS. They will do an interim evaluation report and then a final report that will be provided to CMS ultimately. So just wanted to make sure we're clear about the differences as we're moving forward. So as with any project when we start, it's very important that we understand not just the project, but the client themselves. And the state of Washington is very unique in their approach for this DSRIP initiative. One of the things we know, while we have experience with DSRIP, we're very clear that once you've seen one state, you've seen one state. And that's very clear in Washington as well. So we understand your program was carefully designed by the state and stakeholders. Very, much time and effort went into building this program, building this initiative. So once we began our work in August, as we were awarded the contract, we began researching all of the materials that were available to us. We began working with the state as well on any other resources that we may want to access. So we looked at demonstration documents, we reviewed all of the ACH websites, which were very informative, and all of the Phase 1 and Phase 2 certifications. That was very helpful, including the process documents that went into it before the certifications were completed. We also actively, as you know, collaborate with HCA and MNAT as well. And we reviewed all the guidance that's been provided to the ACHs and all of the relevant materials found in the toolkit, the website. We also conducted, we also have been supporting the public review process of the project plan assessment tool, the criteria and the scoring methodology. I think as you've all moved forward, you've seen the guidance that's been available to you. When we look at other states we've worked with and other states that are doing DSRIP initiatives, the materials that are available, the guidance, the websites in particular, have been very helpful. They're really very robust, and we've been very impressed with that as we move forward through the project preparation. So as Mark mentioned earlier, there are key themes from public comments. We're really going to be focusing on those comments related to project plan assessment and the process. So some of the comments that were made during that period were there were requests to provide greater specificity and examples of how criteria categories will be applied during the assessment process. So we'll be talking about that. With respect to the scoring methodology, there were requests to provide greater clarity about scoring of the supplemental workbook, to give consideration to the complexity of the scoring methodology, and then consider changes to the point allocations for the project plan subsections. And also to provide just more detail overall about the project plan assessment process, which we'll be doing here today. So where we're going to start is the criteria categories that many of you have seen before as part of the public comment. There are 6 categories that have been developed here that we'll be using to help facilitate the assessment. Each subsection of the project plan will receive a criteria rating, and based on that rating, total points will be calculated. So we'll look at each of the subsections as a whole. The thing about the criteria category that's important is that we believe this brings some consistency to the process. But we know that we're doing this in an environment where each of the ACHs are very different. The populations that you will serve are very different, very unique. So understand that we're using these criteria to really help to bring some of that consistency within that environment. This is not a cookie cutter approach. 3 of the criteria are based on completeness, clarity, specificity, and detail, and then logic. It's very similar to what you saw when ACA conducted the Phase 2 certification. I'm just going to give a little bit more detail on what those areas are. And if you'll excuse me. So for completeness, reviewers will confirm that the response addresses all of the section categories and that all attachments are provided. For clarity, the reviewer is really noting whether the response is clearly articulated. So from the response, the reviewer, for example, can understand that a process is being outlined versus it having gaps that create a problem. So there's a couple of lessons learned we will be talking about as we go through this today, but one of the things we strongly recommend, if you've not already done this in your development, the ACH should really review their project plan prior to submission and ask, as you're going through that internal review, is there any room for misinterpretation based on what's been provided? Are we using acronyms or terminology that may not be familiar to a reviewer? Just making sure that it is clear to what a reviewer would be looking at during the review process. For specificity and detail, the response may be thorough, conveying information that allows us to understand where you're heading. The response provides sufficient information to allow us to anticipate where the project will need further development or how it will perform. So one of the things we recommend as you're going through the development process is having someone not related to the project reviewing your project plan. Again, to look for specificity and detail and also clarity to make sure that they're able to understand it if they're not associated with the project now, and how you would accomplish making it clearer. For logic, we can understand how, during the review process, how the ACH plans to progress. There's a clear flow of information on planned activities, the timing makes sense, examples are provided, and it's very clear how the flow will proceed. So let's go to this slide now. It really gets into detail. I'm sorry. I'm just talking and talking right now. So the first one, meets or exceeds criteria, is 100%. You'll see from the definitions here that minor deficiencies may exist, but they're outweighed by the strengths. And these deficiencies can be very easily and readily corrected. So I just want to give you an example of what this may look like. Bear with me for just a second. So if you are looking at completeness here, you're responding to all parts of the subsection, articulating clearly to the subsection, convey the depth of information, and really making sure that it is articulating all the timing, the considerations, the accountability, etc. and the logic provides the rationale between the strategy and the process and the intended impact. One of the things that you'll note from the public comment was this was originally just meets expectations, and this was changed based on comment to meet or exceed criteria. So I want to give you an example for this, so it's really clear that, for example, the response to community and stakeholder engagement provides specificity and evidence about engagement that had occurred and outlines a detailed process with logical steps and activities. All required items have been addressed, but the required discussion of the three elements of the project plan may be missing minor details, and those can be remediated very easily, readily corrected. So 100% of the points available with this criteria. So for the next criteria, it needs moderate improvement. And for this particular category, 80% of the subsection total allocated points will be received based on your performance. For this criteria, our reviewers will have noted overall strengths that are outweighed in certain areas by deficiencies, but we would note these deficiencies during a write-back process, which will allow ACHs an opportunity to remediate again the original response. This is an important part of our process, and in a minute my colleague is going to go into detail about these write-back processes and how this will really lend an opportunity for the ACHs to improve their project plans. So an example that I could give you here is in keeping with the theme of the community and stakeholder engagement. There's specificity and evidence about the engagement that has occurred, and you're outlining the detail and the logical steps, and all of the required items have been addressed, but the required discussion of the three key elements of the project are only listed as, for example, as bullet points. And so information is needed about why these were considered key elements, how they were shaped by community input, and examples of the stakeholders were involved. So just detail was missing that would have given a score of 80%. So for the next category, this needs substantial improvement. And with this category, 60% of the subsection total allocated points will be received. And for this level, our reviewers will have noted significant deficiencies, and the response marginally meets response requirements. So as you can see here that any of these components here, there's something missing that's very significant. So continuing again with our example, the response may provide specificity and evidence about the engagement that has occurred, but very minimal detail about processes that were used to continue engagement. There's a lack of specificity of steps and activities that were conducted, and particularly in regard to engaging local government, county government, for example. The response only addresses maybe, for example, one of the three key elements in the project plan, and so all of this would lead to need substantial improvement. So the next categories would be incomplete and no submission. So for incomplete, there are a few scenarios here. There's a score of 30% of the subsection total point allocation here. And in this scenario, the response does not address the topic. It may go off in a different direction altogether, and while there be content there, it's just not really meeting the requirement. Or there may be certain requirements that are not addressed fully in the response. So for no submission, we would score it a 0 of the allocated points. And in this case, there's missing documentation that's never been submitted. And it will be marked as no submission until the information is received. So the next category is completed yes or no. This really applies to attachments, attestations, and supplemental workbook tabs that have been submitted. This item does not have a separate allocated score, but it's considered in the overall subsection rating and scoring. There are two exceptions that you'll note here on this slide that are the following subsections that do not have scores that given because they're only attestations, and that includes for project metrics and reporting requirements and relationship with other initiatives. Subsections will be marked incomplete if any documentation is missing. So I want to talk a little bit about point allocations. We received several comments during the public comment period about point allocations, and good discussion there. There were questions about why certain issue areas do not have point allocations, such as social determinants, and how the project portfolio will be aligned to work together. The allocations really, as you may know, follow HCA's template design to be reviewed at the aggregate subsection level. Therefore, the point allocations are at the subsection level. However, we do recognize that each subsection includes many questions with varying complexities and required detail that must be considered in the reviews. We will view the project plan to confirm that all areas have been addressed in detail. For example, for the social determinants must be addressed in the regional health plan regional health needs inventory, and we would expect they would also be discussed within the specific project narrative. For the ACH theory of action and alignment strategy, those would have to be addressed. They must address rather the project portfolios there. So when in the comments it was noted about the weighting the sections differently, and so the decision was made to decrease points assigned to Domain 1 subsection and increase community engagement and stakeholder input and tribal engagement and input. So you'll notice that in red for community engagement and stakeholder input, the new points available are 33, and the same for tribal engagement and input. And for Domain 1, the available points has been reduced to 34. So now I'm going to turn the webinar over to my colleague Jennifer Karitzis, who will be reviewing the project plan assessment timeline and approach.
Good afternoon. As Terry mentioned, we will spend the remainder of the time focusing on the project plan assessment approach. Here we have provided a high-level timeline that outlines what we will be going through. So beginning on November 16th, we will receive the project plans from the ACHs to January 31st and February 1st, where we'll finalize the project plan scores. We do want to note that these are estimated timelines for the reviews and write-backs. It is a fluid process, and so, for example, if we complete the reviews prior to December the 8th, we would provide our write-back to the ACHs prior to that time. And given the required timelines throughout this entire time, as well as the holidays, we would ask the ACHs to respond within the designated time frame. So to begin with, when the ACHs submit their plans, we will have a web-based system available for use in exchanging information. It's titled Washington CPAS. Each of the ACHs will have access to secure folders to upload their complete project plans. We will be providing additional details and a user guide to the ACHs about the CPAS web system over the next couple of weeks. In addition, we will have a help desk available, not just in regards to CPAS, but throughout the entire process, should any questions or challenges be encountered, for example, in uploading materials. And then once we receive the project plans and have noted that the files are in the folders, we will send an email confirmation notifying that we have the materials. So we have in our assessment process multiple points of communication. It will be key throughout the project plan assessment that we have a variety of levels of communication with the ACHs. The first one is really just the minimum requirements review that allows opportunity for us to conduct a very high-level review and to provide immediate response back to an ACH if any requirements have not been submitted. So, for example, a narrative box contains no text, or there's a missing attachment. We found in our prior assessment that most missing information is due to oversight in uploading particular documents, such as an attachment. So this is typically a quick fix, and we would ask the ACHs to respond within 1 business day after receiving our notification. We did have several questions about the assignment of our reviewers as we move into our detailed reviews. And so we really want to spend a bit of time right now talking about our review process. We have multiple layers of review and quality checks in an effort to assure that we have captured all information and the intent detailed in the project plan. This also increases our ability to bring some consistency and overall objectivity to the assessment process. We first will have primary reviewers who are assigned by ACH to review the full project plan. This reviewer conducts a comprehensive review, noting areas of strength, questions, and comments. Primary reviewers regularly talk to each other about their findings and will meet daily with the review team leadership to discuss comments or any questions that they may have. In addition to the primary reviewers, we do have subject matter experts who will be assigned to review specific sections of the project plan across all ACHs. So, for example, we would have an expert assigned to review the funding section. These individuals collaborate with the primary reviewer throughout the process. One expert, for example, is our financial subject matter expert, and he has many years of experience in state government, focusing on healthcare financing, budgeting, and project evaluation. He's also performed this same review for another state's independent assessment. So we do want to try to bring in these experts as opportunities present. After the primary reviews are conducted, we have secondary reviewers who will assess sections and projects across all ACH project plans. These reviewers serve as a second set of eyes. For example, if the primary reviewer notes that they could not find specific information, our secondary reviewers are also working to determine if it's there. They review all comments and questions that the primary reviewer has identified for the ACH to confirm they agree based on their reading of the project plan. The primary and secondary reviewers meet regularly to discuss their overall findings. These secondary reviewers also help with consistency. They're reviewing across all ACH plans, not to compare the plans themselves, but to confirm that our reviewers are providing a consistent level of comment and question. Should discrepancies be identified, we then pull the reviewers together to talk about those and come to consensus on kind of the level of discussion that should be taken back to each ACH. Our project management team is also heavily involved throughout the process, conducting quality and consistency checks as the reviews progress. And again, we do meet on a daily basis to discuss any findings and questions. So we have received quite a few requests for examples of how our reviewers would conduct the reviews and how they use the criteria. So over the next few slides, we give brief examples of reviewer considerations. We do really want to emphasize, though, that these are just examples and are not absolute. We recognize each ACH is different, the region in which it operates is different, and therefore the process for planning and operations will also be different. There's not one right formula for the project plan submission, and as such, we will review each submission based on the individual ACH's plan. But using the partnering provider subsection as an example, we've listed here the submission requirements. A supplemental workbook tab must be completed along with a narrative focus. For our reviews, completeness and clarity, we will be confirming that all required elements have been addressed. Have the supplemental workbook tabs been submitted and all fields are complete? Are we able to clearly understand the response? And just as a simplistic example, as Terry mentioned earlier, have a lot of acronyms been used without definition for which we will need to confirm the meaning. And then next, there's specificity and detail. And examples here are around the narrative. You know, it must include a process for ensuring commitment to serve the Medicaid population. So we will review information and data that's submitted to see if it supports that those partnering providers that are engaged serve a significant portion of the Medicaid population. Or if the ACH isn't that far down the road, we want to see that outreach has or is occurring or is planned, and as part of that process, how the ACH is identifying providers committed to serving the Medicaid population. We also want to understand how the ACH's process ensures this commitment. For example, will provider contracts require it? Will there be training provided to providers about expectations? Will there be related monitoring or reporting? The ACH may not be doing all of these, but they're just examples of what might be part of a sound, cohesive approach. On this slide, we just note a few additional questions that our reviewers would be considering in regards to process for engagement of those partners critical to success of a project. For example, our examples included of engagement activities that have or will be undertaken to ensure the right provider types are involved. Does the narrative convey a broad spectrum of provider types that would logically be key to the selected project? Do the providers listed in the supplemental workbook tab support the narrative discussion, or vice versa? In regards to leveraging MCOs, does the response note how they have been and will continue to be engaged? How has information provided been used in planning? Have areas of duplication been determined, or has it been determined that there isn't duplication? Moving to logic, we consider the provider types listed. Are they relevant to the project? And again, do those in the workbook tab coordinate with the narrative? Are there any provider types that are missing but that might be of benefit, and does the ACH have a plan for outreaching to them for participation? Are the processes that are outlined logical in their flow and include appropriate steps? So based on our reviews, we will then be developing what we consider the write-back process, and we'll provide information, comments, and questions to each of the ACHs where we felt that there might be areas that could be clarified, or additional information. We wanted to confirm whether there would be anything additional available that could be added. Again, communication will be key in getting those plans to a point that that they are inclusive and clear. Upon submission of our request, we will ask ACHs to respond within 5 business days. The first write-back will be the most detailed. We work to provide a specific and comprehensive request in an effort to resolve most items during this round. Again, we just want to make sure we're communicating, and so we might request to meet with the ACHs, or the ACHs can request a meeting with us. We found this to be essential in prior assessment. Meeting is sometimes hard to put on paper, and so talking through a particular issue can be really helpful. We have had several questions about direct contact for the ACHs within our review team, and we would ask that any request first be submitted to our help desk. The rationale for this is that we are most effectively able to monitor submissions and to triage urgent requests. And additionally, as the review is occurring over 3 separate holidays, we just want to ensure that response is provided timely should a dedicated team member be out of the office at the time the request is submitted. Additionally, if we're able to get all of the requests to one area, we're able to monitor those and see where there might be trends that we want to communicate across all ACHs. So I won't read through this entire slide, but we did want to give an example of what the ACHs can expect to see for the write-back process. So this table is one that we've developed that has been useful in prior work. And so on the far left column, this is just information from the project plan template, and we just provide that in this document so it's easily referenced. A few folks had asked during the public comment period if the scoring would be provided, and so you'll see here for this subsection, we will be providing the score. So the second column is available points, which are 20 for this particular section. Just using this as an example, we marked the response as needing substantial improvement, which maps to 12 points for the preliminary score. The next column is where we document our request. In this case, we found that the ACH really hasn't provided a substantive response in regards to how partnering providers have been and will continue to be engaged to serve a significant portion of the Medicaid population. Additionally, we have not identified information about outreach to providers of social services in the engagement process. And the identified provider types also do not include providers of social services that one would expect to see for this project. So we've noted those findings, and then we have a column that we would then ask the ACH to complete once they have finalized their response. And we'll provide instructions with the tool when we send it so that ACHs are aware of what types of information to include here. It may be that the ACH is providing a response, or it might be that they're directing us to where the information can be found in updated materials. We do ask that reference be provided so that we can make sure we're capturing any new information. So the next two slides I won't spend much time on. They're pretty repetitive. It's our second round of review. So once we receive the write-back responses, we will again have our primary and secondary reviewers as well as subject matter experts to review those responses. And if necessary, we will draft a second write-back request to the ACHs requesting additional information where we think there can be additional clarification or information provided. We want to note that the second write-back process is the final opportunity for the ACH to submit clarifying or supporting information. Should an ACH believe they've already submitted information, we would want them to reference that either in the first or second write-back process. And again, we would arrange a conference call if needed. And with this write-back, we also would request a turnaround within 5 business days. So again, this is taking the example of our partner provider response. You'll see here that the score has been bumped up to a needs moderate improvement, which maps to 16 points or 80% of the total available points. We've noted that while some of the clarification was made from our first write-back, we still aren't seeing what we think might be beneficial in terms of providers of social services. So we note that and ask for examples, and then the ACH would respond in the same manner. We would ask too if the ACH is not wanting to or doesn't have information to provide that they note that in this column as well. After finalizing our reviews of the second write-back response, we will submit our findings report to ACH by January 19th. I think that the important thing to note here is that ACH does have the final decision-making authority and will make the final determination of project plan approval. So we will be talking through our findings with HCA as well as keeping them apprised of our preliminary findings throughout the review. There is an opportunity for ACHs to request feedback, and this process will occur through HCA. A request would be submitted, and then as needed, we would support that request for additional information. And lastly, given the opportunity for ACHs to decide to drop a project, that will need to occur by January 31st. Should an ACH decide to drop a project, the process that we will use is to recalculate the average score for project plan section 2 and the related valuations. We will not be re-reviewing the full project plan, and we would finalize the findings report to incorporate the recalculated scores. And then lastly, as we've mentioned, we have our help desk. It will be available via an email box, and we'll be providing the email address for that to the ACH very soon. So that is
Yeah. So at this point, I don't know if we have questions. I'm seeing nods that say we do have questions. We'll devote the rest of the time to trying to answer it.
Thanks, Mark. This is Brand Bennett with HCA, and we did receive some questions. So I think to start, and this is would be the one for the Myers and Stauffer team. The question was, if there are different primary reviewers for different ACHs, how will Myers and Stauffer ensure consistency and application of criteria across ACHs?
Yeah, and as we mentioned, we have the secondary reviewers, and the primary reviewers are assigned by ACH project plan, but then our secondary reviewers are reviewing across plans, and so they're reviewing the comments and the questions and the findings of our primary reviewers, and as they do those reviews, the idea is to help bring some consistency across how we are scoring and how we're reviewing. They're talking regularly among themselves. We have daily calls scheduled to discuss what findings there are, and as we mentioned, we have a quality review process as well.
Thank you. So one follow-up question to that just came in, hot off the press. Will secondary reviewers review all 9 ACHs?
Yes.
So several questions actually came in about how points were allocated to each of these subsections within the project plan template. And so I certainly invite Mark and the Myers and Stauffer team to weigh in. But I think I take the opportunity to highlight that one factor that went into this was that the project plan really builds off of the 2 phases of certification that ACHs went through over the past the recent months. And so that was certainly a factor in how points were allocated to these subsections. But Mark or Myers and Stauffer, if there's anything you'd add?
No, I think that's, we've tried to be consistent, starting with the certification process, and also with previous information that we've given out with respect to how projects themselves are weighted. So I think hopefully the kinds of ingredients that we've asked for in the certification, and by implication in the project plan template, that we've tried to be consistent in the scoring approach with kind of the relative emphasis on each of those parts in the project application itself. So hopefully we've achieved that consistency. And one of the benefits of having Myers and Stauffer as a partner in this is that they bring experience from other states, and so it gives us the opportunity in the approach we're taking to use them also as a sounding board to make sure that what we're doing makes sense just from their perspective as having participated in this process in other settings. So I don't know if the team has anything to add to that.
Great, thank you. One item for clarification, so perhaps for someone on the Myers and Stauffer team. The question was, will an ACH receive a score for each of the 4 elements cited, so completeness, clarity, specificity, detail, and logic, separately for a section, or do those all aggregate up to a single score, and how is that handled?
They do aggregate up to a single score for each subsection. The reviewers are looking at a subsection as a whole. The completeness and so forth give us kind of a format for looking at those, but it is reviewed as a whole response. And so if, for example, there are specifics there, but the specifics are a bit jumbled or unclear, then that's considered the clarity of that. So we would be providing responses in our write back to try to get that clarification. Terry, do you have anything else to add?
No.
they're not individually scored or weighted in any particular way in terms of those particular elements.
Great, thank you. Another question that came in that for clarification is the calculation of the project plan score conducted for each project put forward individually, or do they get an overall score for the subsection 2 or for section 2 of the project plan?
So section 2 is each project is scored separately, and then the average of each project plan score is taken to provide a total for section 2.
Thank you. An additional question on clarifying the criteria used. Can an ACH receive a meets expectation on a section if they don't have specific detail for an item but have an adequate response as to how they will achieve that level of detail during the planning phase?
It's really, I think it's a bit challenging to answer that without seeing what the response is. You know, I think we're looking for comprehensive responses in regards to the questions outlined in the project plan. So if there's not specifics provided, it doesn't seem that, you know, a full score would be received. But it's kind of a bit hard to answer that without having details of what that looks like.
Maybe this is a good question for our team. So for Mark, in general, how will ACH support ACHs in developing robust sustainability plans for the efforts that they put forth in their project plan?
So there are a number of components to sustainability. I think they really all start with the ingredients that go into the description of each project. So for example, having an adequate, and I realize that defining adequate is a challenge, but having an adequate set of partnering providers for which engagement can really be demonstrated in the project application is a very significant ingredient, I think, to long-term sustainability. In other words, those partnerships are being established early, and which creates the opportunity to just build on them over the course of the 5 years. There are, of course, the foundational elements of Domain 1 that I think also factor into sustainability. And I think as the ACHs know, we continue to work with them and will continue to work with them on attention, especially to those Domain 1 ingredients for value-based payment, workforce development, and population health management. Those are critical components, I think, to long-term sustainability, and we'll continue in answer to the question specifically about what will HCA do. We remain committed to working with the ACHs to make sure that those foundational components are there and last throughout the course of the project. I think it's really a matter of choosing projects that the ACH knows are important to the community as well, so that it's not a matter of, if you will, the ACH imposing a project upon the community, but really having a partnership with the community to know that what's being undertaken has enough really engagement from the community at large to help assure that the projects that are established will in fact be sustainable over the long run. So those are just my own thoughts about what goes into sustainability. Hopefully that answers the question. I invite any others on the team to weigh in on that as well.
Great. Thank you, Mark. So I'm just trying to keep up with the questions coming in. So there was a question about by February, if that's when the finalization of the project plan scores will be determined, the question of when will funds then be distributed to regions, which is a very good question, and I can go ahead and just speak to that and say that the process is still being worked through, and certainly more information on that will be forthcoming. There's another question. So do project plan scores determine whether or not an ACH is eligible for the bonus tied to the number of projects chosen? Mark, there is an update that you might be able to provide related to this question.
We're actually, I think as ACHs know, we are taking a look at specifically at valuation and scoring. Probably not in the best position to answer that question today, but we'll be providing more information on that shortly.
Thank you. There are a couple questions about the level of familiarity that the independent assessor will have with the previously submitted certification documents, which I think is a great question. Similarly, how much cross-referencing would an ACH need to do between the information that they previously provided and the information that is requested in the project plan template? And so,
our team is reviewing all of the phase 1 and phase 2 certification responses, as well as the feedback provided by HCA for those. The request is that the project plan be a standalone document. So instead of referencing back to the phase 2 or phase 1 certification responses, we ask that all information be included within your project plan. We will not be using those materials within the scoring process, but more so to familiarize ourselves with ACH's plans before we get into the actual project plan review.
Thank you. So I think that we're just right about at time, so we'll go ahead and wrap up today's discussion. Thank you for joining us, and please reach out should you have any questions.